1. When designing an MSRA preparation curriculum, which principle of adult learning is most essential to ensure candidate engagement? A. Emphasizing memorization over application. B. Incorporating real clinical scenarios relevant to practice. C. Using only text-based materials for simplicity. D. Avoiding learner autonomy to maintain structure. 2. An educator evaluating MSRA mock exam performance decides to combine quantitative scores with qualitative written reflections. This process best represents A. Summative assessment. B. Norm-referenced evaluation only. C. Mixed methods evaluation. D. Criterion-referenced pass-fail scoring only. 3. During a mentorship session, a trainee expresses anxiety about MSRA situational judgment questions. The most effective mentoring approach is A. Redirect the learner to the handbook without discussion. B. Normalize their concern and explore strategies for managing uncertainty. C. Advise them to focus only on clinical knowledge. D. Discourage further questions to avoid dependency. 4. Which instructional strategy best supports long-term retention of MSRA clinical problem-solving concepts? A. Massed learning in a single long session. B. Distributed practice with spaced repetition. C. Relying exclusively on reading guidelines. D. Encouraging last-minute cram sessions. 5. When creating MSRA situational judgment training items, alignment with which framework ensures ethical decision-making representation? A. Cognitive behavioral therapy models. B. Professional medical regulatory standards. C. Personal tutor preferences. D. Generic workplace behavior scales. 6. A facilitator wants to determine whether the MSRA training program improves higher-order decision-making skills. Which evaluation method is most appropriate? A. Counting attendance. B. Post-course multiple-choice quiz only. C. Pre- and post-assessment using scenario-based judgment tasks. D. Tracking time spent on modules. 7. In adult learning, providing MSRA candidates with control over the sequence of topics supports which principle? A. Overregulation. B. Self-directed learning. C. Passive learning. D. Single modality instruction. 8. A supervisor notices a learner repeatedly struggles with prioritization tasks in MSRA practice cases. The most effective mentoring response is to A. Provide targeted feedback with examples and alternative reasoning. B. Have the learner review the same cases again without guidance. C. Recommend more reading without discussion. D. Ignore the issue until formal assessments. 9. When developing MSRA teaching materials, ensuring that objectives, activities, and assessments all match is known as A. Backward design. B. Inductive coding. C. Summative scheduling. D. Benchmark leveling. 10. In MSRA situational judgment preparation, modeling verbal reasoning aloud demonstrates which instructional approach? A. Cognitive apprenticeship. B. Minimal guidance approach. C. Competitive peer learning. D. Task avoidant teaching. 11. An educator wants to reduce bias in evaluating MSRA practice responses. Which strategy best supports fairness? A. Using standardized scoring rubrics. B. Allowing subjective impressions to weigh heavily. C. Scoring learners differently based on experience level. D. Skipping calibration among evaluators. 12. A candidate asks for feedback, but the mentor only says "good job." This violates which best practice of effective feedback? A. Feedback should be vague. B. Feedback must be outcome neutral. C. Feedback should be specific and actionable. D. Feedback should be withheld to promote independence. 13. What is the most effective way to adapt MSRA teaching materials for diverse learners? A. Rely on a single instructional method. B. Integrate multimodal resources aligned with learning objectives. C. Use only advanced texts regardless of learner background. D. Require learners to discover resources independently. 14. A course designer wants to ensure the MSRA preparation course meets regulatory expectations. Which source is most authoritative? A. Informal blogs. B. Social media consensus. C. Official MSRA and NHS recruitment guidance. D. Peer anecdotes. 15. When analyzing learner performance, identifying patterns across multiple MSRA scenarios is an example of A. Microfeedback. B. Thematic evaluation. C. Random error sorting. D. Non-diagnostic assessment. 16. Which approach best promotes critical reasoning in MSRA clinical questions? A. Encouraging trainees to memorize question stems. B. Facilitating discussion that explores reasoning pathways. C. Teaching candidates to pick answers quickly. D. Avoiding deeper analysis to save time. 17. During a workshop, encouraging learners to share prior clinical experiences helps support A. Andragogical learning principles. Pedagogical silencing. C. Restrictive instructional practices. D. Purely theoretical engagement. 18. A mentor designs a reflective activity asking MSRA candidates to analyze their own decision-making errors. This supports A. Metacognition. B. Rote recall. C. Surface-level learning. D. Performance suppression. 19. In curriculum development, which step ensures the MSRA course aligns with learner needs? A. Conducting a needs assessment. B. Randomly choosing topics. C. Avoiding learner consultation. D. Designing lessons before analyzing gaps. 20. If scoring consistency across multiple MSRA evaluators is low, the most appropriate corrective action is A. Ignore discrepancies. B. Conduct score calibration sessions. C. Reduce the number of evaluators. D. Switch to a non-scored format. 21. Which teaching technique best helps learners master MSRA time-pressured decision-making? A. Simulated timed practice with debriefing. B. Unlimited time practice only. C. Blocking all timing constraints. D. Eliminating feedback to reduce overload. 22. A faculty member models inclusive communication during MSRA group training. This helps learners develop A. Rigid hierarchical structures. B. Professional interpersonal skills. C. Non-collaborative tendencies. D. Reduced self-efficacy. 23. When writing MSRA practice questions, ensuring the distractors reflect realistic clinical errors supports A. Authentic assessment design. B. Non-functional distractor design. C. Arbitrary item construction. D. Surface-level guessing. 24. A mentor encouraging candidates to set personal score goals and track progress is reinforcing A. Learned helplessness. B. Goal-directed learning. C. Passive study behavior. D. Compliance-only motivation. 25. Which evaluation method provides the strongest evidence of MSRA course effectiveness? A. Learner satisfaction surveys only. B. Skill demonstration and performance improvement data. C. Instructor preference scoring. D. One-time attendance verification. 26. When delivering MSRA feedback, the feedback sandwich is less effective than A. Direct, specific, criterion-referenced feedback. B. Avoiding feedback altogether. C. Using feedback only at course end. D. Providing only positive comments. 27. A course director mapping MSRA competencies to learning modules is practicing A. Curriculum alignment. B. Non-systematic scheduling. C. Arbitrary sequencing. D. Linear task avoidance. 28. Encouraging MSRA learners to evaluate sample answers against rubrics develops A. Self-assessment accuracy. B. Memorization habits. C. Response avoidance. D. Dependent learning. 29. When designing MSRA digital modules, ensuring they are accessible to learners with disabilities supports A. Universal design for learning. B. Exclusive content gating. C. Performance restriction. D. High barrier instruction. 30. A trainee feeling overwhelmed by MSRA prep benefits most from which supportive communication strategy? A. Active listening with validation. B. Minimizing their emotions. C. Redirecting without acknowledging feelings. D. Advising them to just study harder. 31. In assessing MSRA readiness, which data source provides the most actionable insights? A. Final exam scores only. B. Patterns in repeated mock exam performance. C. Attendance counts. D. A single open-ended reflection. 32. When supervising MSRA study groups, modeling open reasoning and respectful debate supports A. Psychological safety. B. Defensive argument culture. C. Competitive hostility. D. Passive observation. 33. A mentor helping candidates identify their strongest learning modality and study pattern is applying A. Personalized learning support. B. Randomized learning pathways. C. Unstructured autonomy. D. Rigid one-size-fits-all teaching. 34. In preparing candidates for the MSRA's Professional Dilemmas section, which instructional approach most effectively improves situational judgment performance? A. Passive review of ranking rules only. B. Facilitated group discussion using varied clinical scenarios. C. Memorization of predetermined correct responses. D. Independent reading of medical ethics guidelines without application. 35. When evaluating a mock MSRA session, which feedback method best supports a learner's metacognitive awareness? A. Providing only the final score without breakdown. B. Allowing candidates to self-identify reasoning errors before instructor input. C. Giving the correct answers immediately without reflection. D. Focusing exclusively on time management rather than decision quality.